So we're going to be talking about some of the steps we're taking to bolster our healthcare workforce. But as always, we want to give a quick update on monkeypox, COVID, and so let's just get started with that. When it comes to our COVID cases, happiness, you can see there's been a stabilization. Statewide, that's encouraging news. But also, we're going to prepare for the fall. I did an announcement on this several weeks ago. Our fall action plan has getting 3 million test kits into schools, which we think is critically important because every child needs to be in school this fall, and we have to keep them safe. But the experiment of education at home is in the rearview mirror. We don't want to go back to that. We need these kids in school, so we're getting test kits out to them as well. Our PPE stockpile, again, with foreign supply chains that have only worsened since the pandemic, we're also building up our reserves, as well as promoting boosters, vaccines, testing, and treatments. And our cases, again, stabilizing most places, but we continue to monitor. As soon as there's a little shift, we launch into action and find out what's going on there, making sure that people are getting all the supplies of vaccines and booster shots they need. Also, the monkeypox outbreak, as you know, we announced a declaration of emergency, and here's why. We're seeing higher cases. You can see them across the state, about 1,617, growing quickly. And we'll be talking about our vaccination allocation as well. We have 170,000 to date, making sure that we're receiving our fair share. As I mentioned before, this is a conversation I've had with the White House. They originally were allocating based on population. We are not the most populated state, but we are the state with the highest number of cases. So we wanted them to shift how the allocations were going, so that even though there's a limited supply globally. So we're working around the clock to do that, as well as a public education campaign to really talk about the vulnerable communities. Let's get this out there. We're not shying away from this. Dr. Mary Bassett has been doing an incredible job just speaking truth and telling people what behaviors are at risk and being really smart about this. So, but as we said before, about 1 out of 4 cases in this country are in New York State, and with a high concentration in New York City. So, the reason we declared a declaration of emergency, it allows us to respond more quickly. What does that look like? That means when we do have more of a supply of vaccines, which we're anxious to get our hands on, we can have more people allocate them other than just physicians. That allows us to have EMTs and pharmacists and others in the healthcare system, midwives, people who can help administer them. So when you get under a crunch situation, you want to have more people who are eligible to do this. We needed the declaration to do this. Also, we want the providers to send us the vaccine data information, which they weren't required to do before. So working with the White House around the clock as well, Dr. Jha, who we're in regular communication with, other federal officials. We're glad to see that the administration is stepping up. We also have Dr. Dimitri Deskaloudakis is from New York City. He's on the White House panel, so he is our direct point of contact to make sure we get our share. So we talked about the fact that we'd be soon getting 760,000 more doses, more vaccines. The federal government will be getting that many more, and 110,000 were coming to New York State, 80,000 of which are going to New York City. You can see our allocations thus far, our different tranches. Our last allocation we're waiting to get those out to add to the numbers in New York City as well. New York City gets them directly from the federal government, but in our phase 3, we've allocated over 16,000 statewide. We're going to be doing about another 12,000 more, and I'm allocating an additional 4,000 to the city on top of what they're getting from the federal government. So that's what we're looking at the disease burden, where it's most concentrated, and we're being really smart about that. So we're confronting this outbreak with the urgency that it requires, our full-on attention, and trying to protect the communities and getting the vaccines out there.